You want to get rid of your lower face jowling sagging? That's what we're going to talk about today. There are non-surgical therapies and treatments that work pretty well for this. Hi, I'm Dr. Michael Cutler at San Diego Integrative Medicine and Spa in San Diego, and I'm going to talk to you about how to handle this very common condition of the lower face sagging and jowling. First of all, we have to understand that the face hangs on some bony structure, and there are fat pads in there that also give some plumping and volume of the face. This lower face, however, cannot simply be injected with Botox to try to hit some muscle. The creases go away because the creases are formed by the sagging in the lower cheeks as they get aged and thinner and drooping. First thing I think of for that correction is facelift. Most people don't want to have an expensive surgical facelift when there are non-surgical alternatives to do. So we need to understand, how can we do this non-surgically? First of all, you need to know that the bony structure of the cheeks can be tightened. Filler in here can be placed to give nice rounded rather than sagging cheeks, and also collagen stimulator like PLLA, known as Sculptra Aesthtics, causes the body to generate new tissue. That in a series of injections through a cannula give the preauricular area and the cheek area a lift, tightening area. Now we move to the lower face. What can we do for the skin? Well, first of all, one of the common conditions that I see is a little accumulation of fat there. If you have an accumulation of fat right there, putting filler in there may not be so aesthetically pleasing until you can digest away those little pockets of fat. That's what I use the PCDC, which is phosphatidylcholine deoxycholate injections, very judiciously placed in a fat accumulation, can help shrink those down. And after that process, 2-3 treatments, maybe 6 weeks apart, now the creasing is a little bit less, but still you got that skin that wants to sag down. So we need to do things to tighten that skin. I'm going to talk to you in a moment about the lifting of actually PDO, polydioxanone, in the Eurothreadlift technique. But first I want to talk about how to prepare the skin for that, because you don't want to just jump to that one treatment. There's several things that need to be addressed to help correct this sagging and constant jowling effect that wants to accumulate and occur over the years, right? So I don't jump to just filler in the marionette region. A filler, it can look good, but that over the years is going to continue as the filler metabolizes and goes away. In a year approximately, those creases are going to come right back. Why? Because the skin is jowling and sagging. We need to tighten the skin, we need to lift the skin, right? So we've talked about how to try to get the lower face a little tighter with Sculptra Aesthetic or filler. Now let's talk about how to get this skin tight. Sculptra Aesthetic can also help tighten this, firm it up. So think of it like an old piece of paper that's weathered and worn. It gets like an old piece of dollar bill where it's just gonna fall apart versus the crisp new strong bills. And that skin is what we want to create with Sculptra Aesthetic. In the lower face, it's done through a cannula on either side. I place a liquid. It goes through the process of stimulating collagen, and in 6 to 8 weeks you see a little tighter skin each treatment that's done. So there's that. And then we say, what else can we do to tighten the skin over here? Well, we can use radio frequency. So heat, I use the Viora machine. The V-form has a small head that gives a suction effect, puts heat in and helps to dissolve some of the fat and tightens the skin. So that can help. And then we get one of my favorite treatments is using your blood drawn out, and then a slow spin down creates what we call PRF, platelet-rich fibrin gel. And this gel is what dentists have used for decades to help prepare for implants in the bony jaw. So this helps give structure to the tissue around the mouth. You can use for upper lip lines to tighten that skin, but it's just small injections of your blood before it turns into the gel, which is generally within 30 minutes, and that creates a new tissue growth as well. So it's a regenerative fluid, much like PRP, platelet-rich plasma, platelet-rich fibrin matrix, or platelet-rich fibrin gel is placed in these areas all around the mouth to help tighten that skin. Now we're still sometimes dealing with a jowling effect that gravity is pulling down. Well, first I would look at the jawline, which can be a bony, mimicking bone using HA, hyaluronic acid filler, can be done to give a better jawline. Chin, right? But still, that little sulcus wants to go in there. Sometimes I'll put in filler there, but not to widen the lower face. We don't want to make you look puffy down there. So you don't just fill it up with filler, right? Which is going to dissolve quickly. We want to do things that will help lift that tissue if we can. Now, my favorite treatment using the Eurothreadlift, the 150 millimeter 18 gauge 6D or 8-dimensional barb, can do the whole side and lower bit of the lower face. But then my other favorite is to just do the PDO thread lifting effect using two kinds of threads that are barb kinds. So you can see this brand. This brand has the lifting effect because of the barbs. So this is a 20 gauge, 70 millimeter length, and this is inserted after a little local anesthesia. It's placed under the skin and dragged to these positions. Typically from this, it's not a super good anchoring point, but it does give an anchoring point to help pull and tighten skin. So it's from here, it's placed forward towards the corner of the mouth, a little bit lower than the corner of the mouth and a little bit lower. I typically use a couple of these, the 70 millimeter, and then I love to use one or two of these longer ones. These are 100 millimeter length. These are larger, 18 gauge, and they'll give a stronger tightening effect and stronger lifting effect. So you can see the leader needle there, the insertion. It's a cannula that's inserted through the skin, pushed into position, and then the skin is inched back onto those back barbs to help give a tightening lift effect. So this would be the Eurothreads 18 gauge 100 millimeter lifting barb threads. The PDO threads for the jaw lift after we've done what we can to tighten skin, fill in areas, create structure, tighten, create collagen induction. These are all ways to help give a non-surgical lower jowl and lower sagging face tightening and lifting effect. And this is what I do here at San Diego Integrative Medicine and Spa. Love to hear your comments. Love to have you subscribe. Join us here for our next video. We're making them every week.